Pregnancy and having a child are major events in a woman's life. Whether this is your first pregnancy or not, you may be filled with excitement and confidence. At the same time, you may feel uncertain and overwhelmed. These emotions are common during labor. In preparation for your delivery, you might have obtained guidance from relatives, friends, your obstetrician, or the internet. Perhaps you were warned about the pain associated with childbirth. Every woman's experience of labor and pain is unique. This program explains why labor and delivery is painful and how the pain changes from early contractions to the delivery of the baby. We also discuss the pain associated with cesarean section should one be required. Then the program presents pain management options available to you during your labor and delivery. Lastly, we discuss the use of anesthesia for cesarean sections. Analgesics are medications that reduce pain sensation, and anesthesia refers to the elimination of all painful sensations while you're awake or asleep. Pain changes during labor and delivery. Ask your anesthesiologist and the obstetrical team any questions you might have about your pain and the topics we will review here. Our goal is to make you feel confident and in control. We will work with you to make your experience as pain-free as possible. With less pain, you will be able to focus on your delivery. Explanation of labor and delivery pain. Let's begin by discussing the pain of labor and delivery. Pain is difficult to explain because everyone experiences it differently. Labor can be divided into 3 stages: the contractions, delivery of the baby, and the delivery of the placenta. These stages and how long they last vary among women. The first stage of labor is from the beginning of contractions to the complete dilation of your cervix. You may hear your obstetrical team discuss how dilated your cervix might be. This stage is normally the longest one during labor, and the initial pain results from the uterus contracting. You may feel a dull cramp in your belly, your back, between your buttocks, or your upper thighs. As this stage progresses, the contractions and the pain increases in intensity. However, the pain may not be constant. It usually diminishes between contractions. As the delivery of the baby approaches, the contractions may become more intense and closer together, and altogether more painful. This period can range from a few minutes to a few hours. You might shake, shiver, become nauseated. You may feel physically and emotionally drained. This is normal. Your doctors and nurses will be there to help you through this. The next stage is from full dilation of your cervix until the delivery of your baby. If you've already had a vaginal delivery, this stage is usually shorter. Some women are relieved the delivery has finally begun, while others feel that the pain and pressure are intensifying. Delivering your baby causes your vaginal walls to stretch and applies pressure to the area above your vagina and between your vagina and rectum. This pain will be a more direct and sharp stinging sensation. The final stage is from the birth of your baby to the time the placenta is delivered. This is usually the shortest phase, but can last up to 45 minutes. This phase marks the end of most women's pain. Should a cesarean section be necessary, you will be transported to the operating room. A cesarean section is a surgical procedure, and the anesthesia team will use either epidural, spinal, or general anesthesia to eliminate any pain sensation. We will discuss these techniques in more detail later in this program. After the cesarean section is complete and the anesthesia wears off, you may feel pain from the incision. Initially, an intravenous line will be kept in place through which you can receive additional pain medication. After the first day, most women are able to start taking pain relief medication by mouth. Analgesia modalities for labor. There are methods like walking, breathing techniques, showering, and massage that can help you control your pain. When these measures are not enough, what can the anesthesia team offer you to control your pain? One of the most effective options to control pain during labor is the epidural technique. The epidural technique requires the insertion of a needle into your lower spine to allow for a small catheter to be placed there. A local anesthetic is then injected through this thin tube. The pain relief will be from your waist down, and it may take 10 to 20 minutes after the medications are first injected for it to take effect. The epidural catheter is kept in place to allow for continued pain relief through labor and delivery. Here's how it's done. You will have an intravenous line placed. You may also be given an antacid and anti-nausea medication through the intravenous line to decrease the possibility of vomiting. The anesthesiologist will ask you to either curl up, as shown here, either sitting up or lying on your side. It is important to push your back out to make the placement of the needle easier. The anesthesiologist will then apply a liquid antiseptic to your back and a sterile drape over the area. Once the anesthesiologist identifies a spot to place the needle, you will be asked to remain still, which may be difficult if there's a contraction. Do not worry, the anesthesiologist will wait. First, a numbing medication is injected into your skin. You will feel a pinch and a sting. The anesthesiologist will then place the epidural needle into your lower back. You may feel some pain and pressure as the needle is advanced. The anesthesiologist advances the needle until identifying the correct position. There is little risk of causing nerve injury. You may feel a sensation similar to an electrical shock down your buttocks or legs. This should only last a few seconds, and it is usually of no consequence. Communicate any sensation of pain or electrical shock to the anesthesiologist. The catheter is then threaded through the needle, and the needle is removed from your back. A small amount of medication is then injected. To look for any reaction to the drug, you may be asked if you are dizzy or have a funny taste in your mouth. If everything is fine, the rest of the medication will be injected. You may feel a brief cool sensation in that area, which is normal. This catheter is carefully taped down to prevent it from coming out and is connected to a pump that continues to administer the medication. To make certain that the epidural is working and that you are getting adequate pain relief, you may be asked to rate your pain. The amount of medication given by the pump can then be adjusted. The catheter remains in place until the anesthesiologist removes it by simply taking off the tape and pulling the catheter out. You may feel the medication wear off over the course of a few hours. You may also begin to feel sore and may experience some pain. Make sure your nurse and the obstetrical team know how you feel. They can provide pain relief through an intravenous line or by mouth. The epidural allows you to remain alert and does not make you feel drowsy. The pain relief felt by most women can be very relaxing. The medication can be adjusted to meet your pain requirements. Should a cesarean section be required, the same epidural catheter can be used to administer anesthesia. You may need a urinary catheter if you are unable to urinate on your own. Usually, you do not lose strength in your legs. However, the numbness in your legs might make it difficult to walk, so as a precaution, you may have to stay in bed for the rest of your labor. The medications used in an epidural can be a combination of local anesthetic and narcotic. These drugs may cause nausea, vomiting, itching, fever, and shivering. Another side effect of epidural could be a drop in blood pressure. Rare side effects include the slowing of your breathing, infection, or bleeding at the injection site, and reaction to the medication used, including seizure, paralysis, or even death. We will monitor you closely. Extremely small amounts of the medication do reach the baby, but there are no differences seen in babies from mothers that use epidurals and those that do not. You may breastfeed your baby if you choose to do so afterwards. There are circumstances that may prevent us from giving you an epidural. If you are on any medication or have any condition that affects blood clotting, if you have neurologic disorders, or if you've had prior lower back surgery. Some women worry that an epidural may work too well and that the numbness might make pushing difficult and prolong labor. However, most women appreciate the reduction in pain, allowing them to concentrate more on pushing. Finally, there are concerns of getting a severe headache after an epidural or experiencing lower back pain afterwards. There is a 1% chance of getting a severe headache caused by the epidural. After the epidural is removed, it is possible to experience lower back pain for a day or two. However, there is no connection between lower back pain beyond a couple of days and the use of epidurals. A patient-controlled epidural analgesia, or PCEA, is a handheld remote to control the epidural medication pump. By pressing the button on the PCA, the pump provides you a small dose of medication to manage episodes of increased pain. It is not possible to over-medicate yourself. Small doses are used, and the pump is programmed to administer a set amount of medication over a period of time. It has been observed that women require less medication when they use a PCEA compared to traditional epidurals. We will check with you often to make sure that the PCEA is providing adequate pain relief. A helpful hint is to make sure that you are pressing the button often, especially as labor progresses and the pain increases. The combined spinal epidural, or CSE, combines the instant pain relief of a spinal with the continued pain relief of an epidural. The CSE procedure is identical to the epidural placement, except that a thinner spinal needle is inserted into the epidural needle after it has been placed. The spinal needle delivers medication into the space that contains your nerves and spinal cord and then is removed before the catheter is placed. The medications used for CSE are the same ones used for an epidural, and because of the direct delivery of the spinal, lower doses may be used. This allows you to move your legs comfortably, move around in the bed and sit up, and even walk around with assistance. Similar to the epidural, the medication used will not make you drowsy, and the pain relief will allow you to relax. The lower amounts of medication used mean that less will reach your baby. Potential side effects are the same as an epidural: a drop in blood pressure, itchiness, nausea, and vomiting. Easing the pain. In addition to the methods discussed above that can decrease the sensation of labor and delivery pains, there are other medications we can use to help decrease anxiety and promote relaxation. However, these medications will not provide the same level of pain relief that an epidural or combined spinal epidural can provide. Remember that it is okay to change your mind about the type of pain relief you are receiving. We are more than happy to work with you if these medications we are about to discuss do not meet your needs. Sedatives. Sedatives are medications that allow you to rest and relax. They do not directly relieve your pain the way that analgesics do. However, by helping you to decrease your anxiety, sedatives may actually lessen your pain by preventing you from tensing your muscles. Tensing your muscles contributes to your pain by increasing the pressure on your uterus. While staying active through labor is highly desired, if you are experiencing a large amount of anxiety or several hours of pain and discomfort, a sedative may be helpful. In such a case, the rest provided by a sedative may give you the energy necessary for you to actively participate as you approach delivery. Sedatives are given by mouth, by injection, or through an intravenous line if you have one in place. While sedatives can add to your sense of comfort, the side effects include dizziness, nausea, vomiting, sleepiness, or a slowed heart rate. Possible side effects your baby might experience from these medications include sleepiness or difficulty maintaining a normal body temperature. The risk of your newborn experiencing side effects increases when the medication is given intravenously or in combination with a narcotic, or if the medication is administered at a time closer to delivery. However, it is rare for newborns to experience the side effects due to a single dose of the medication. Your care team will advise you if you are too close to delivery to receive a sedative safely. Analgesics. Many women experience both anxiety and severe pain during early labor. A sedative combined with an analgesic can help you relax and lessen your pain before active labor begins. Analgesics are prescribed for pain relief, and there are two types, either narcotic or non-narcotic. Narcotic analgesics are mainly used during labor since they are much stronger than non-narcotics. These medications can help reduce the intensity of the pain you experience with each contraction without affecting the strength of your contractions. Analgesics are given by injection or through an intravenous line if you have one in place. Analgesics are an appealing substitute for women who are trying to avoid an epidural or cannot have an epidural. In addition to pain relief, narcotics can produce grogginess and lightheadedness. Other side effects include nausea, vomiting, itching, slowed breathing, difficulty urinating, and constipation. Side effects to your baby may include slowed breathing, reduced or floppy muscle tone, or difficulty with initial feeding. If necessary, there are medications available to reverse the side effects of the narcotic. As with sedatives, your care team might advise you to avoid these medications close to delivery to prevent side effects to the baby. If you have a current or past history of drug abuse, analgesics will be less effective at relieving your pain unless high and possibly unsafe doses are used. Because we would like to provide you with a safe and effective method for pain relief, please let us know if you have had or are currently using any type of recreational drugs. Local anesthesia. Local anesthetics are pain relief medications that when injected into a part of your body cause that area and only that area to become numb. If the area between your vagina and rectum is torn during your delivery, local anesthetics can be injected directly into the area so that it can be sewn back together without pain. Just like local anesthetics can be injected into the spine during an epidural, they can instead be injected into the vaginal wall during labor. This is known as a pudendal block. This type of local anesthesia is only effective during the pushing stage of labor in order to numb the vaginal and rectal areas. A pudendal block will not relieve the pain of contractions. It is not common for you or your baby to experience side effects after a pudendal block. In rare cases, however, your newborn may experience a slowing of his or her heart rate after a pudendal block. Anesthesia for cesarean section. In the event that a cesarean section is required, let's make sure you understand the options that the anesthesia team will use to prepare you for the procedure. If you already have an epidural in place, it can be used to provide anesthesia for the procedure. The pain coverage will last well into the period after the procedure. If you do not have an epidural, the team will give you a spinal anesthesia. Spinal anesthesia is similar to an epidural, but a thinner spinal needle is inserted into your lower back. The injection is given and the needle removed. The medication is directly injected into the space that contains your nerves and spinal cord, so the effects are much faster than with an epidural. Your breathing and blood pressure will be monitored closely. You may experience a numbing sensation starting at your toes and coming up to your belly and chest. The sensation of your chest being numb may feel unsettling, and you might feel short of breath because of it. This is due in part to the change in sensations. In reality, you are breathing normally. We will be there to reassure you of this. Medications used will provide 2 to 4 hours of feeling numb and up to 24 hours of pain relief. Spinal blocks provide fast pain relief. Very low amounts of medication reach your baby because of lower doses of medications used. Similar to an epidural or CSE, you are alert, awake, and relaxed. Side effects include an occasional headache, lowered blood pressure, itching, nausea, shivering, and difficulty urinating, which is resolved by placing a urinary catheter. Rare side effects include nerve injury or infection. We would not be able to give you a spinal block if you had the same conditions that limited our use of an epidural: being on any medication that affects blood clotting, having any neurologic disorders, or prior lower back surgery. General anesthesia. While the epidural and spinal block are the preferred methods of anesthesia during a cesarean section, general anesthesia is used in emergency situations in which rapid cesarean delivery is required. General anesthetics are drugs that put a patient to sleep instantly, or, in other words, makes them unconscious so that they do not feel any pain during an operation. If for any reason you need general anesthesia, the anesthesiologist will first give you oxygen by a face mask. Medications are then given both by an injection in your vein and inhaled through a breathing tube that is inserted into your windpipe after you are asleep. Sleep comes within seconds, so you will not feel any pain. The baby is delivered quickly once you are asleep, and you will most likely not remember anything that happened while you were under general anesthesia. As the medication begins to wear off and you begin to wake up, you may feel groggy, confused, or nauseous. Your throat may also feel sore from the breathing tube, and you might start to feel pain from your incision. Most likely, you will still be getting pain medications through your intravenous line. Please let your nurse or the obstetrical team know if your pain is not improving or is getting worse. A serious but rare complication of general anesthesia is the aspiration or breathing of vomited liquid or food while you are asleep. This can lead to breathing problems and inflammation of the lung, known as pneumonia, or even death in extremely rare cases. During your surgery, your anesthesiologist will take many steps to prevent you from vomiting or breathing it in case you do vomit. Another complication of general anesthesia, which may, in extremely rare cases, lead to death, is difficulty inserting the breathing tube into your windpipe. Again, this breathing tube is needed to keep your airway open during surgery and also to deliver inhaled anesthetics. This may become more difficult during pregnancy since the mouth and the throat are more likely to be swollen. The medications used in general anesthesia may reach your baby. However, your baby will most likely not be affected. Although not common, your baby may feel and appear drowsy. These effects will wear off. Although the need for general anesthesia can be a surprise for a laboring mother, the obstetrical and anesthesia teams are prepared to support you through any emotions or troubles you may experience. We hope that this presentation has been helpful in providing you with information about your pain relief options. Your comfort and safety is our primary concern. If you have any questions or would like further explanations, please do not hesitate to ask us.